GP surgeries see a lot of young people who are struggling with their mental wellness. Symptoms like low mood, anxiety, OCD, phobias, and issues with body appearance might seem invisible, but they're just as real and impactful to patients and just as important to your GP or nurse. There's a lot going on in your body as it changes and grows from childhood through puberty, teenage years, and into your 20s. It's easy to see physical changes on the outside, but we can't always make sense of what's going on the inside, and believe me, it's a lot. Just like at other transition points in life, like menopause and pregnancy, hormones are responsible for much of what is happening. When hormone levels change, it can make us feel happy, sad, energized, exhausted, hungry, confused, and many other things as well. Look, it's okay to feel unsure about all of this. You might not like the way you look or the changes going on in your body or head. You might be excited about it. You might compare yourself to your friends and wonder why you seem to be developing more quickly or slowly. The loss of contact with your friends and teachers over the pandemic may have made school relationships tricky, and you might be feeling unsettled if you've also had the added wrench of changing schools during the pandemic and missing out on some of the usual end of school celebration. So, what can you do to help? Well, if you're feeling sad or anxious, then please start by checking in with a trusted adult, maybe a parent or carer or a teacher. Your school may have a dedicated nurse or counsellor you can chat to. If you're worried about a friend, encourage them to speak out about the way they feel. Honestly, anyone struggling isn't alone. 1 in 6 young people has a mental health difficulty. That's pretty much 5 children in every classroom. On a positive note, there are lots of things you can do at home that could help you feel better. Did you know that what you eat, how much sleep you get, and how much exercise you do can hugely affect your mental wellness? Caffeine in energy drinks and coffee can cause problems sleeping, anxiety, tremor, and agitation. Sugary snacks are great for an instant burst of energy, but they get broken down in your body in a way that makes you feel sluggish and sometimes even quite sad soon afterwards. Cannabis and excessive alcohol can cause anxiety and low mood, and of course, please don't smoke. It's damaging to those around you as well as causing bad breath and problems getting an erection. So on the plus side, healthy eating can actually help you feel better. Almonds, walnuts, chamomile, and kiwi are a few foods that can help you sleep well, and getting enough sleep can help boost your mood. Remember to turn off those screens well before bedtime to let your brain wind down. And think about your alarm too. Do you really want to wake up to an industrial siren or offensive rap lyrics, or would some uplifting or funky music set you on a better path for the day ahead? Okay, let's move on to getting active. All exercise is brilliant for anxiety and low mood. This is because when you're anxious, your body has a lot of free adrenaline floating around, and exercise can help you absorb it. Exercise also releases chemicals in the brain that make us feel great. So get stuck into school sports, or if you prefer to train from the comfort of your own home, have a look at Joe Wicks on YouTube. And lastly, seek out the facts. There are some brilliant learning resources out there helping improve understanding as well as building positivity and determination. Check out the Rebel Girls podcast. Dr. Chris and Dr. Zand Investigate, which is on BBC iPlayer, and apps such as Wobot and Headspace. And while we're talking about web-based info, remember there's also a lot of negativity in the news right now and violence in video games. So adults, make sure you know what your youngsters are accessing online. Surround them with positive role models online as well as in person. So what happens when you speak to your GP or nurse about how you're feeling? Well, don't be scared. Remember, we're on your side. We'll ask you gently some questions about what's going on in your life right now. We might run through a tick list of symptoms like tiredness, difficulty concentrating, crying for no obvious reason, feeling irritated, headaches, butterflies in your tummy, feeling dizzy, and more. We'll cover the lifestyle type changes above that you should try for starters. And we often use talking as part of treatment too. For instance, counselling or CBT. CBT is all about understanding how our thoughts and feelings and emotions are linked, and this deep insight can be hugely helpful in dealing with your problems. You can self-refer for this through your GP surgery's website. There are also some great web-based versions and apps to try. Have a look at Silvercloud, Calm, and Moodivate. Now, sometimes mood problems are linked to underlying issues like anemia or low thyroid, which your GP surgery will be able to recognise and treat. And we occasionally need to give medication for mood too. If we do, we'll always talk you through the pros and cons of this first. Okay, time for a quick recap. If you're a parent or carer, talk to your youngsters about the sorts of symptoms to look out for and seek help if you're worried. There doesn't need to be a taboo around feelings, and it's important they can seek help with emotional difficulties just as they would with a painful ankle. Check out the NHS website, York Mind, Recovery College Online, and Young Minds for more information. Young Minds have a free helpline for parents Monday to Friday. If you're a young person struggling with any of the issues outlined here, please speak to your friendly local GP or nurse. We can arrange a face-to-face consultation where necessary, we can make an urgent referral to Young People's Services for further treatment if needed, and we can provide regular follow-up. We are really experienced at supporting and treating young people to help you lead happy and healthy lives from childhood up to young adulthood and beyond. Thank you.